Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. We're going to be speaking with Dr. Craig Eagle in this segment. He's joining us here as Chief Medical Officer at Guardant Health to discuss a new study that was published in Nature Medicine, which demonstrated that using the Guardant 360 liquid biopsy test can help guide treatment decisions for patients with HER2-driven metastatic colorectal cancer. Welcome to Health Professional Radio, Dr. Eagle. Thank you so much for joining us this evening.
Hi, Neil. Thanks for having me.
Well, give us a bit of your professional background, if you would, and then talk briefly about your role as Chief Medical Officer at Guardant.
Yeah, sure. So I trained as a hematologist in hematopathology as well as in malignant hematology, and I've been working in the pharmaceutical industry and diagnostic industry for some time now. And part of my role at Guardant is overseeing our development of our diagnostics and testing within the cancer field and in the screening field as we move forward, exploring new opportunities.
Now, as far as Guardant 360 is concerned, could you give us a brief overview of this liquid biopsy test, including its clinical efficacy, if you would?
Sure. So Guardant 360 is a innovation moving forward that allows advanced patients with cancer or metastatic cancer patients to actually have a test. It's called a liquid biopsy, and as many of your listeners probably are aware, provides comprehensive genomic profiling through a blood test. And this is what makes it special, is that rather than going to do a tumor biopsy or trying to get access to the cancer cells itself, as the DNA and genomic aberrations from the cancer shed in the blood, we're able to take that sample of blood and test it. And the other good news about this, not only does it open up the field of testing, enabling cancer to be tested more times than in the past as it evolves, but also it's a quick turnaround time. So we're able to take the blood and turn the test around and get the genomic profiling results back to the oncologist or treating physician in a very short space of time compared to tissue. And in terms of the science, I mean, this was the first FDA-approved liquid biopsy blood test for advanced cancers. And we're currently continuing to build up our knowledge and database. We've got 250 peer-reviewed publications with over 60 clinical outcome studies, and currently more than 10,000 oncologists are using our test.
Is the speed of the test the main factor when it comes to helping in the treatment decisions of these patients, or are there other factors that help in that treatment decision based on the Guardant 360 test?
It's really both aspects. So the speed of the test is certainly a critical factor. It's been shown in the past that delaying in starting the right treatment for somebody with advanced or metastatic cancer can actually reduce their outcome. And this makes sense. The longer you leave the cancer untreated, the worse the outcome. So from that perspective, getting the test quickly and getting the treatment started is absolutely positive for the patient. The second piece, of course, is what treatment. And this is where genomic profiling and the liquid biopsy test also comes in, by able to see the genomic profiling of the cancer, not just at the time we traditionally do a tissue biopsy, but at any point through that journey with the cancer that the patient undergoes, enables personalized selection and genomically driven decisions around what treatment could work best for that patient. So it's a double win. Turnaround time, speed to get to the right treatment, which has the genomic testing to direct that treatment.
There was a study published in Nature Medicine, I do believe, the TRIUMPH study. Could you give us a brief overview of that TRIUMPH study and talk about why it was conducted and I guess some of the main takeaways?
For sure. That study is a phase 2 study, the TRIUMPH study. It's focused on colorectal cancer in a progression setting. So these are people that have had a previous treatment, particularly focused at EGFR. And this is a good example where Guardant 360 and a liquid biopsy can really come to its fore. It's known that colorectal cancer, when you treat them with EGFR, actually progresses with different mutations and different clones of mutations. And one of those is HER2. And so this study was really looking at, can we pick up patients whose colon cancer is progressing and develop this HER2 over-amplification through blood testing, and then introduce them on the right type of treatment, which in this case was a HER2-directed treatment of pertuzUMab and TRastuzumab, and see if we can alter the outcome for these patients in this setting of refractory or progressive colorectal cancer.
Now, there are other of these types of tests on the market. How is Guardant 360 significantly different from others that are out there?
So there's a few things we need to think about when we think about Guardant 360. First up, as I mentioned, the TRIUMPH study, it basically allows us now with the data of this particular study to actually look at patients that are progressing in colorectal cancer, who develop this mutation and this resistance to then undergo a treatment. And the good news was that this study also demonstrates some of the advantages of Guardant's technology. So Guardant 360 is a suite of products. So if you imagine in this study, people were tested, they were found to have overexpression of HER2 or HER2 positive colorectal cancer, given the treatment, and then approximately 3 weeks after the treatment, they had another molecular test, which is another test that Guardant has in its repertoire. So how is G360 different? We can not only find the patients, as example in the TRIUMPH study, we can then test very quickly, is the therapy working? And then we can follow up again with Guardant 360 to see if the patient continues to respond or a different mutation comes to the fore. And this is exactly what happened in the TRIUMPH study. So people that were found to be HER2 positive responded much better than traditional chemotherapy, giving this HER2-directed therapy, molecular follow-up test, and then basically some of the patients then had other mutations sadly develop as their cancer became resistant to that therapy. And so these are the sorts of things where Guardant now provides the package. So you can imagine having a Guardant 360 and then your follow-on tests all done through Guardant enables you to really have the journey of cancer documented very carefully with Guardant 360.
Are there other tests that you've developed for cancer patients? And is cancer the only thing that Guardant 360 is indicated for?
So Guardant 360 is focused on cancer. It's focused on the diagnostic stage of cancer, looking for those genetic makeup, but also at the progression side of cancer, which is the area that's opened up by these liquid biopsy tests. People traditionally would have to undergo often complex or tricky biopsies, but now with the blood test you can check the cancer and its evolution genetically, and therefore, as I mentioned before, find the right treatment. There are other tests that we're developing, so there are people that have their cancer detected early and it's treated, it's removed, say, by surgery, and then you wonder if the cancer really removed or is it still there, and so we have a test called Guardant Reveal that looks at these minimal residual disease that escaped the surgical field, if you like, and follow patients that way. We also have Response, which is the one I mentioned where you start treatment in the metastatic advanced setting and you have response. And then we're also looking, of course, the carcinogenesis process. The development of cancer can start very early on, and that's part of our screening effort with our product there, looking at trying to pick up cancer right at the early stage so we can really get people early and remove the cancer very early in the stage when we have more success.
Well, if you would, give us a website where we can learn more about Guardant Health, if you would.
The best place to find more information is at guardanthealth.com.
Well, I appreciate you joining us here on Health Professional Radio this evening, Dr. Eagle. Thank you so much for your time, and hopefully we will speak again.
Thank you very much, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Craig Eagle, Chief Medical Officer at Guardant Health. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.